Hello, I'm Dr. Sarah Nafziger. I'm the Medical Director for the Paramedic Training Program at Jefferson State Community College. The purpose of this video is to provide you with some essential information so that you can function as a clinical and field preceptor for our paramedic training program. First, we'll talk about the purpose of our rotations. The rotations allow our students to further develop some of the knowledge that they've worked on in the classroom. We focus on three main areas, which are the minimum competencies required of an entry-level paramedic, the skills that the students have learned in the classroom, and finally, we want the students to learn to model behaviors that are consistent with an entry-level EMS provider. The first area we'll talk about is minimum competencies. The students are required to develop their minimum competencies through patient assessments. We categorize these in three ways: by complaint, by the impression, and by age. Assessments categorized by complaint are roughly grouped into the following categories: abdominal pain, respiratory complaints, chest pain, altered mental status, pediatric respiratory complaints, and change in responsiveness. Our accrediting body considers change in responsiveness to be consistent with syncope or patients who are unresponsive. So there's a little bit of overlap there, certainly with altered mental status. The next category for minimum competencies is assessments by impression. One of these is obstetric, and note that this does not limit the patients only to patients who are in labor, but also any patient who is pregnant counts as an obstetric patient. Abdominal complaints, patients with trauma, patients with psychiatric problems, respiratory complaints, stroke, and cardiac arrest. The next area of minimum competencies is assessments by age, and we break these down into several different age categories to cover from cradle to grave. The next way our students develop minimum competencies is through skills. Now, of note, the students that you'll see are paramedic students, and they've already had a lot of practice doing medication administration, IV access, and ventilations, and they've also learned to do blind insertion airway devices. These are things that they learn to become an advanced EMT. An additional skill that paramedic students learned is endotracheal intubation. Now, of all the skills that our students perform, the skills of airway management are the one that we have the least opportunity to train in. And it's probably one of the most important skills that they have to learn. So we would encourage you, whenever possible, to give our students opportunities to learn about airway management, including bag valve mask ventilation, ventilating patients who are already intubated, endotracheal intubation, and any of the other skills that are associated with airway management. Another way that students learn their minimum competencies is through being a team leader. This doesn't mean that we completely turn the students loose to function on their own. They're still under the direct guidance of their preceptor, but what we would like the preceptors to do is step back and allow the students to guide the team and guide the resuscitation or the care of the patient. Of course, anytime guidance is needed, we would urge you to provide that guidance and redirect the students when necessary. The behaviors we expect of our students are for them to be on time and to be prepared. They should show initiative and be eager to learn. They should work well with others, and they should show that they're empathetic both to the patients and their coworkers. Above all, we want our students to be professional. We want them to behave in a manner that you would expect of someone who's a new employee to your institution. Our program uses several evaluation tools. The students need to document all of their activities in order for them to graduate from the program. The students will complete a patient assessment form for each patient that they encounter, and at the end of their clinical rotation, they will do a rotation summary form. The rotation summary form documents all the activity that they did for this rotation. It includes evaluations that you provide of the student, as well as the evaluations that the student provides for the preceptor and the clinical site. Your job as preceptor is to verify the accuracy of the rotation summary form, and most importantly, to sign the summary form indicating that you've reviewed it and verified the accuracy. This is the scale that is used to evaluate the students on the rotation summary form. The minimum competency that we require for our students to successfully complete a rotation is a level 3. If a student falls below a mark of 3 on their summary form, we will further investigate. Therefore, if you have a student who you feel really does not meet the mark of competency on their clinical rotation, we would ask that you provide us some comments about how the student can improve their performance. If you wish to provide those comments in a confidential manner, that's certainly fine as well, and you can email those or give a phone call to the clinical rotation coordinator or the program director. That would certainly be acceptable. Here's contact information for the program director of the Jeff State Community College. At any time, if you have any problems, feel free to contact Mr. Nafziger or the clinical rotation coordinator. Overall, we want to say a big thank you to you because our clinical preceptor sites and our field internship sites are really what makes this program successful. Without your involvement, we would not be able to provide adequate training to our paramedic students. So thank you so much for your investment in the future of EMS.